Sexually Transmitted Infections by Jonathan Willoughby. Sexually transmitted infections, or STIs, are a major global health issue affecting millions of people annually. The World Health Organization estimates that over 1 million new STI cases are acquired every day worldwide, with approximately 374 million new infections each year. STIs are classified into bacterial, viral, and parasitic categories. Common bacterial STIs include chlamydia and gonorrhea, while viral infections such as HIV and HPV can have severe long-term consequences. Parasitic infections like trichomoniasis also contribute to the burden of STIs. The health impact of STIs extends beyond the immediate symptoms, often leading to infertility, cancer, pregnancy complications, and increased vulnerability to HIV. Raising awareness, encouraging early diagnosis, and promoting prevention strategies are crucial to tackling this global health crisis. Sexually transmitted infections are classified into the three main categories: bacterial, viral, and parasitic. Understanding these classifications is essential for diagnosis, treatment, and preventions. Bacterial STIs include chlamydia, gonorrhea, and syphilis. These infections are caused by bacteria and are generally treatable with antibiotics when detected early. However, antibiotic resistance is becoming a growing concern, particularly with gonorrhea. Viral STIs such as HIV, HPV, and herpes are caused by viruses. While some, like HPV, can be prevented with vaccines, others, like herpes, remain incurable but manageable with antiviral medications. Parasitic STIs include trichomoniasis and pubic lice are caused by parasites. These infections are typically treatable with prescription medications and good hygiene practices. Recognizing the different types of STIs helps in adopting effective prevention and treatment strategies. Bacterial sexually transmitted infections are caused by bacteria, can often be treated with antibiotics. The three most common bacterial STIs are chlamydia, gonorrhea, and syphilis. Chlamydia is the most prevalent bacterial STI, with millions of new cases reported annually. Many people with chlamydia do not show the symptoms, which makes early detection through testing crucial. If untreated, it can lead to an infertility and pelvic inflammatory disease. Gonorrhea, sometimes called the clap, is another widespread bacterial STI. A major concern is its increasing resistance to antibiotics, making treatment more challenging. Gonorrhea can infect not only the genitals, but also the throat and the rectum. Syphilis progresses in distinct stages, starting with painless sores and eventually leading to severe complications such as neurological damage and organ failure if left untreated. Early detection and antibiotic treatment are key to preventing long-term harm. Viral sexually transmitted infections, STIs, pose a significant health challenge because they often persist in the body indefinitely. The four most common viral STIs are HIV, HPV, herpes, and hepatitis B. HIV attacks the immune system, and if left untreated, it progresses to AIDS, which is life-threatening. While there is no cure, antiretroviral therapy, or ART, helps manage the infection and allows people to live long, healthy lives. HPV is the most common STI, with some strains causing genital warts and other leading to cervical and other cancers. Vaccination is an effective prevention strategy. Herpes, caused by the HSV1 or HSV2, results in painful sores and has no cure, but antiviral medications can help manage outbreaks. Hepatitis B is a serious liver infection that can become chronic, increasing the risk of liver failure and cancer. A vaccine is available for prevention. Early detection and medical management are critical to controlling these viral STIs and reducing transmission. Parasitic sexually transmitted infections are less common than bacterial or viral STIs, but remain as health risks. The two main parasitic STIs are trichomoniasis and pubic lice, or crabs. Trichomoniasis is caused by the parasite Trichomonas vaginalis and is one of the most common curable STIs. Many infected individuals have no symptoms, but if left untreated, infections can increase the risk of other STIs and pregnancy complications. Antibiotic treatment is effective. Pubic lice, also known as crabs, are tiny parasites that infest pubic hair and feed on blood. They cause intense itching and irritation. These lice are transmitted through close physical contact and are eliminated through medical shampoos and through the cleaning of personal items. It's also thought that they would become extinct in a matter of time just due to people's different hygiene preferences of removing their hair. While these infections are treatable, prevention through safe sexual practices and personal hygiene remains key. Recognizing the symptoms of sexually transmitted infections is crucial for early diagnosis and treatment. However, many STIs are asymptomatic, making regular screening essential. Genital symptoms are the most noticeable and include unusual discharge, sores, warts, itching, and burning sensations during urination. These symptoms can vary depending on the infection and may go unnoticed for long periods. Systemic symptoms such as fever, fatigue, and swollen lymph nodes can also indicate an underlying STI. In some cases, flu-like symptoms may appear, particularly in viral infections such as HIV or syphilis. If left untreated, STIs can lead to severe long-term complications. These include infertility, chronic pelvic pain, pregnancy complications, and increased susceptibility to HIV. Certain infections, like HPV, can lead to cancers of the cervix, anus, and throat. Understanding STI symptoms and seeking prompt medical attention can prevent further health complications and transmission rates. STIs primarily spread through sexual contact, but other transmission routes exist. Understanding how STIs spread is crucial for prevention. The most common mode is through sexual contact, including vaginal, anal, and oral sex. Many STIs spread via bodily fluids such as semen, vaginal fluids, and blood. Others, like herpes and HPV, spread direct skin-to-skin contact. Some STIs can also be transmitted non-sexually. Hepatitis B and syphilis, for example, can spread through shared needles, blood transfusions, or from an infected mother to her baby during childbirth. Several factors increase the risk of STI transmission, including having multiple sexual partners, engaging in unprotected sex, and lacking knowledge about STI prevention. By practicing safe sex and undergoing regular testing, individuals can reduce their health risks and protect their overall health. Early detection of STIs is critical to preventing complications and reducing transmission. Many STIs are asymptomatic, making routine screening essential, especially those for sexually active individuals and those at higher risk. Several testing methods are used to diagnose STIs. Blood tests detect infections like HIV and syphilis, while urine samples and swabs help identify bacterial and viral infections such as chlamydia, gonorrhea, and herpes. Physical examinations may also be conducted for visible symptoms. STI testing is confidential and accessible. Clinics, hospitals, and community health centers offer testing services, and at-home kits provide a discrete option for individuals seeking privacy. Early detection ensures timely treatment and reducing long-term health risks and transmission rates. The treatment and management of sexually transmitted infections vary based on the type of infection. While some STIs can be cured with medication, others require lifelong management. Bacterial and parasitic STIs, such as chlamydia, gonorrhea, syphilis, and trichomoniasis, are typically treated with antibiotics. However, antibiotic resistance is a growing concern, particularly for gonorrhea, making proper medication adherence crucial. Viral STIs, including HIV, herpes, and hepatitis B, cannot be cured but are managed with antiviral therapy. These medications help control symptoms, reduce viral loads, and prevent disease progression. HIV, for example, is treated with antiretroviral therapy, which enables individuals to live healthy lives while minimizing their transmission risks. Ongoing monitoring and follow-up care is essential in STI management. Regular checkups, partner notifications, and treatment help prevent reinfection and complications. Comprehensive care includes individuals receiving proper guidance and support for their STI management. Preventing sexually transmitted infections required a combination of behavioral, medical, and educational strategies. By adopting safe practices, individuals can significantly lower their risk of acquiring and spreading STIs. One of the most effective prevention methods is practicing safe sex. Using condoms and dental dams during vaginal, anal, and oral sex provide a barrier against STI transmission. Consistent and correct use of protection significantly reduces infection rates. Vaccination is another crucial tool in STI prevention. The HPV vaccine protects against the strains that cause cervical cancer and genital warts, while hepatitis B vaccine prevents serious liver disease. Expanding the vaccine coverage has helped reduce STI-related health complications worldwide. Routine STI screening and public health education campaigns play a vital role in prevention. Regular testing allows for early detection and treatment, while awareness programs encourage responsible sexual behavior. Combined efforts in education and medical intervention contribute to the reducing STI prevalence and improving overall public health. Sexually transmitted infections are a major public health issue with significant medical, economic, and social consequences. Globally, an estimated 374 million new cases of STIs occur each year, placing a heavy burden on healthcare systems. Beyond the immediate symptoms, STIs have serious long-term health effects. Untreated infections can, again, lead to infertility, pregnancy complications, chronic pain, and increased vulnerability to HIV. Some, like HPV, are linked to cancers. The economic and social impact of STIs is substantial. Billions of dollars are spent annually on STI-related healthcare, including diagnosis, treatment, and long-term management. Additionally, stigma and misinformation contribute to discrimination and prevent people from seeking timely care. Addressing STIs require global efforts in prevention, education, and policy making to reduce their overall burden on society. Also, in this semester, there's been research pointing towards bacterial vaginosis as an STI. Most recent research has begun to think of bacterial vaginosis as an STI as opposed to just something that occurs. The addition of combined oral and topical antimicrobial therapy for male partners to the treatment of women for bacterial vaginosis has resulted in a lower rate of reoccurrence of bacterial vaginosis within 12 weeks compared to standard of care. The women received first-line recommended antimicrobial agents, and the male partners received oral and topical antimicrobial treatment. Metronidazole 400 milligram tablets and 2% clindamycin cream applied to the penile skin, both twice daily for 7 days. Reoccurrence occurred in 24 of 69 women, which was 35% in the partner treatment group, and 43 of 68 women, or 63% in the control group. This is new research, so more will be forthcoming, and of course that's not something that will be testable on the FNP because it's too new. So current standard of care, just women with antimicrobial agents would be the treatment. And it would not be considered an STI. So this is a test question from Ross Review. An 18-year-old man who is sexually active presents with dysuria and copious penile discharge for the past 3 days. Urine dipstick shows positive leukocyte esterase and negative nitrites. Which one of these following is considered first-line empiric therapy? So we have cefoxiamine, Rocephin with doxycycline, ceftriaxone with doxycycline, doxycycline with azithromycin, and metronidazole. Those are the four choices. So it is B. The most common pathogens identified in urethritis in men are chlamydia and gonorrhea. Chlamydia is the most commonly reported sexually transmitted infection in the United States. Men with urethral symptoms such as dysuria, discharge, and burning or tingling should be tested for chlamydia and gonorrhea, although chlamydia infection in men is most often asymptomatic. Gonorrhea can be asymptomatic in a significant portion of men, but is most often symptomatic with copious spontaneous penile discharge. In this patient with presumptive gonorrhea due to copious penile discharge, chlamydia is most likely a co-pathogen. For patients whom chlamydia has not been ruled out, a course of doxycycline and a single dose of ceftriaxone, 500 milligrams IM, is first-line empiric therapy. Repeat testing at 3 months for reinfection, and treatment of partners is also recommended. Answer A, and other cephalosporins and are no longer recommended for a regimen for gonococcal infection because of the increased resistance. Doxycycline with erythromycin, which was answer C, are not used together in the treatment of urethritis, but doxycycline can be used as a substitute for azithromycin, especially given increasing rates of resistance to azithromycin. And then D, metronidazole is used for the treatment of trichomoniasis. And then this is just the answer there. Gonorrhea, chlamydia, clinical things are dysuria, pruritus, and discharge at the urethral meatus. Rocephin 500 milligrams IM, 1 gram IM for patients that are greater than or equal to 150 kilograms, and doxycycline 100 milligrams twice per day for 7 days. Also remind them to be careful of the sun because doxycycline and sun don't mix. Read that in a book once. All right, these are my references. Thank you much.